bouncing off of each other.
I mean, between my stink shirt and this isn't so bad.
It's a clean shirt.
I have a lot
it's
of
just
smells.
been in my gym bag.
Strange smells. What the hell are we doing?
I don't know.
What are we doing today?
You're the director.
Okay, well, we're going to do some reaction videos.
Of chiropractic, mostly. Some good, some bad, some funny.
Just
Some
tack shop.
educational. Yeah. So here we go. Let's crack her open, boys. Welcome to Spinal Tap.
This is a house of learned doctors. You're not a doctor.
Doctor?
Doctor?
Doctor!
Doctor.
Doctor!
Wait a minute, Doc. Are you telling me that you built a time machine?
I am a doctor. You're not a doctor.
Hi, guys.
Hello.
Everything's live. You look like you're going to fall asleep. You all right?
It's a lead-lined room.
We've been on a little hiatus,
Yeah.
I guess you could say.
2 months.
It's been a little bit, a lot of things.
We're like a monarch butterfly.
Mm-hmm. We went into hibernation.
We're in the cocoon phase.
We're more like a
the chrysalis.
brown bear.
The pupus.
Pupaneous. Subcutaneous.
Like a brown bear.
I just looked at
like
a meme
that.
regarding the old bear coming
old
out
bear?
of the cave.
Oh, yeah.
Like when you're a dad.
Yeah.
Your dad and you go to sleep with your kid. It's like, oh. That's us now, but we're back at it. We got
Content.
Richie. He's not really a guest, but he got a spot at the big boy table today. So
Feels good.
we're gonna do some reaction videos.
If this works. Doing kind of a live reaction video of videos.
Mm-hmm.
That's
Very
it.
meta.
Mm-hmm. Yeah. But we get a lot of patients that come in and they go, "Oh, did you see this? Is that a good thing? Is that a bad thing?" And it's usually a bad thing. It's on the internet. It's pretty bad.
Well, especially new patients,
Yeah.
people that haven't been to a chiropractor before.
I have been asking, have people who don't go see it, haven't seen a chiropractor, go, "Did you do any online research?" And they go, "No." And I go, "Yes."
Good. Let's start there.
Because
Yeah.
there is a component of educating patients on what their expectation should be working with a chiropractor. I don't think I know from experience, some people, they come to us and they go, "This chiropractor just did this and I didn't know it was happening." And that's a sign of you didn't do education.
Well, that's the majority of people's bad experiences is from not communicating what's going to happen.
Like a surprise attack.
And I do tell patients that all the time. I'm like, just so you know, it's not gonna be like a surprise. Like in my exam, I'm like, just so you know, like,
Yeah.
you'll know when I'm about to adjust you.
And I think too, part of the idea with this episode is that there's a number of videos or like styles of chiropractic videos that we've always, I would say we pride ourselves on avoiding. One of them being like, we're going to use an attractive human being, usually a female.
Because we're real ugly.
Because we're not so good looking.
Can I give you the
Well,
top?
we should also preface that is not a slam to anybody that we have videoed.
Absolutely not.
Because your wife is one of them.
We only video dogs.
Yeah.
Just real.
So if you've been on our videos, sorry.
Sorry, everyone.
We just don't discriminate.
Yeah.
Whether
And well, I think we're trying not to leverage that. We're trying to focus on like the practical applications of what you guys are doing and avoid the eye candy. And then also like the shock and awe of things like the ring dinger. And you know what? I'll go on record saying that content is insane and it gets a ton of views, but it's really kind of scary.
Oh yeah.
And yeah, so that was kind of the idea. So those that don't know, before you watch it maybe, or after it, what is a Y-strap and what is its purpose?
Well, it's like a form of traction, which traction essentially is gapping of our spinal joints. This is a, I'd say, more intense version. It relies on quick movement to create separation, which kind of bypasses some of the receptors in our neck, versus like a traditional like table or traction where like over time it'll loosen that up. Yeah. And like, I don't know. It's a lot of force.
So like we learned of this adjustment in school. I don't think I recall being in class and doing this.
I know.
But at a seminar, the doc was.
So there's somebody holding his knees.
So it creates a little pin because she would.
Yeah.
Oh my God.
Yeah. And her knees are at the end of the table and she moves up probably like 16 inches.
Yeah.
So that's some.
I mean,
some
she's
force.
still alive.
Yeah.
She's
This
moving.
adjustment happens all the time.
Her
Whenever you're
reaction
like-
is more mild than some
Yeah.
people's, where they're
Yeah, she's
That's
probably
probably not her first.
she's been adjusted like this
seasoned
Can
strapper.
you-
Season Y strapper.
on the
It like crunched that base of my neck. In that area, I felt like a crackle.
Good.
Yeah, it was good.
So she's probably talking about her CT junction, which is clinically not the easiest place to adjust. A lot of people avoid it because it's just hard on the chiropractor's body. I will attest out of personal experience. I had a Y-strap adjustment that injured me.
Oh,
Like it over-adjusted me.
Oh.
I've recovered, obviously, and I didn't disbelieve in the technique because I was personally injured. But
Right.
A lot of people...
Well, you're probably not the candidate for a Y strap either.
this guy's from Houston.
So people
I mean, this guy's millions and millions of
people
views.
come to see him.
Right. I think I've seen some famous athletes and
yeah.
celebrities with him.
He's famous. That's P. Diddy.
His last known public sighting.
This is on an island somewhere. So he does a lot of exposition. So and he does a basic. So like he's doing just a visual.
It's a basic handshake.
That's a grip
Vigorous,
test.
wow. 150 pounds grip.
He's gonna look up and down. He's gonna make some notes. He's gonna crisscross on his pad of paper there. Everyone's got their own system.
Yeah.
So he's getting right after it.
All right.
Oh, yeah.
So tell us what we're seeing now. Why this? Why the
So,
elevated legs?
Elevating legs, it flattens the lumbar curve a little bit, so you don't have as much extension. And then also he's putting some pins in right now that go right above his hip bones, his pelvic bones, that stabilize him, so it'll create more of a full spine
So isolating.
decompressive force. Yeah.
Okay.
Team ring dinger. It's like he's got this thing.
So he uses a towel. So he
That was
just,
fast.
Yeah.
Yeah.
I kind of want to feel his ring dinger.
Yeah.
That sounds inappropriate, but
so that one's probably like the difference with that one and the black strap, the one that we just watched, is like the black strap will create a focal point in whatever part you put it on the cervical spine, versus that's like a more broad, like you're tractioning his head away from his spine, but you'll get an over body. So like the black strap will, if you like, you can target
Select
a little
the-
bit. You can kind of select like what area.
Okay.
So the strap that goes on your neck, you can have that as your fulcrum point,
Yeah.
so you can be higher. And we do some of this with patients, but it's more of just like a simple traction. Like we don't like do a vigorous pull, but you can do some decompressive force with patients and kind of select. So I'm guessing that's part of their exam too. Their exam process is figuring out like obviously what segments need it, whether it be based off their exam or x-rays or
I mean, that's the good thing and the bad thing about chiropractic, because you say like, oh, I see a chiropractor, and they just say that, or like
Yeah.
I had a bad adjustment. It's
Yeah.
like, well, what? Let's dive into that.
So
Yeah.
so many different flavors. Like you don't like that flavor. Well,
Yeah.
then-
it's every profession.
Right.
Even when people tell us like, hey, have you seen a PT? They'll usually be like, yeah, I saw a personal trainer. I'm like, no, sorry.
Yeah.
Doctor of physical therapy.
Yeah.
And like
Their
with a lot
reactions
of
are
this
just like,
stuff,
holy
a lot of the stuff, like he's just getting motion
He's just-
into your body.
just getting it
Motion's
moving.
good.
Yeah.
I mean,
Look at this big boy. Oh, large Texas man gets his first
That's the
chiro.
Oh, that's
title?
the- that's
large
an-
Texas man.
no, Lufkin. Oh, that's a boy.
Holy moly.
Dab. It's like a dab shirt.
But I mean, like, for example, this patient comes into our clinic. We go, okay, what are we going to do? And it's very different from adjusting a less big person. But you can see he's doing similar assessment. He's very consistent with what he's doing, which is a good thing, like, for patients. Oh, she is filling out the paperwork. She's like, I got to get this done before he gets the ring dinger.
Yeah.
So
Yes,
there
he
we go.
consents.
Wow. Well,
Yeah.
Oh.
I love that.
I want to see
That's
where,
a
where
lot
he,
of-
I want to see where he felt
So,
it.
So
this
he's
is fun-
checking.
This is his little joke, which I think is, I mean, if you're a chiropractor and you don't have a sense of humor,
Yeah.
you're gonna
And he
suck.
goes, "Oh,
ass.
you're
I
still
want to
kicking,
see.
right?"
Yeah.
I want to hear the guy's like, response.
It's a home run.
So
Oh yeah, got a little.
big boy.
What's that thing he has in his hand?
So he's
It's-
gonna do. This looks like a murder. This looks like a murder for sure.
So it's probably, it looks like a arthrostim / electric activator.
Okay.
Adjusting instrument, like an
Okay.
impulse.
It's
gun.
a postural adjustment.
Yeah.
So there's some techniques. I don't know. CBP does it. They do like mirror image adjusting. So if someone has forward posture, you put them in an extension posture and then work on. So in CBP, I can speak to it. You work on the points in the spine that have a lot of nerve output. So occiput C1 is a good place. You'll go on the deltoid tubes and hips. That's a big rabbit hole to get into, but it's just like little points that you can put some vibration into the area while you're in a certain position, and it's like telling the nervous system, like, please be here.
Oh, cool.
It's not like one and done type of thing, but it's just another layer.
This is a stimulus. Postural restoration is kind of like the overarching umbrella
Like-
of that technique.
Spinal. Mike Tyson, when he's
I
I broke my back.
I broke my back.
What do you mean by that? You
My
broke
back is broken.
what? A vertebrae or what
Well-
portion?
Spinal.
So this guy here, Hightower.
So what's the head on that?
I think can't remember if these are his proprietary tools, but it's
So
like
it's just
Stone
like an
Age.
activator.
It's Stone Age activator.
Okay.
Yeah.
Okay.
Like it's a little bit of a flare. I mean,
It's just kind of a.
he probably has his reasons, like ergonomically, that might kind of be nice to have that. Like maybe he worked with tools as a
He might
youngster.
have. Yeah, that's true. And it's kind of like,
It's niche-y.
it's niche. Yeah. Very.
But apparently this guy's like really good with shoulders.
Oh.
But to be honest, if you want to throw a quick, I mean, that hammer is obnoxious.
Oh.
But for
It is
his mass
obnoxious.
times acceleration, if you got like
Yeah.
a 2-pound hammer here, he doesn't have to
Sure.
swing it hard to
Mm-hmm.
like get some action. But if you're specific and you're assessing and looking at, I mean,
So
it's great.
tell us mechanically what's happening inside of the
He's
the
probably
body
working
right
on
now.
a few things.
Yeah. So you can see this
The beard.
hunk of a man like responding. So I mean, he's putting a mechanical stimulus in a joint that isn't moving properly. Like you can, like
In other words, he's putting motion into a stuck joint.
right. So and this guy's like, oh shit, that's pretty cool. I mean, there are some chiros out there that would say, oh, bullshit, you're putting a mechanical stimulus in the joint. Of course it's going to move better. Well, that's the whole fucking point of
Right.
getting adjusted. And they're like, well, that won't last long. It's like, yep, I'm not going to like come in next time. We'll see how you are.
Yeah.
So in defensive chiropractic technique.
It's he's
It's
just
very cool
putting-
to see.
Yeah, just a stimulus, and same not only in the joints but in the muscle bellies too. Like when he gets in the upper traps, like through there, that's probably working more muscle.
Yeah.
Like you're just
Like a
a
isolated-
percussive, like it's like a percussive massage tool,
Yeah.
but it's just a different, different way
Like,
to do it. I
There's
guess.
a big one. This is really mild compared to that one video I'm trying to
I know what you're
find.
talking about.
But so he's doing pre and post checks. Like,
Yeah.
fine, good, like it. Try it out.
Try it out.
We don't have much training in it, so you're not going to see it at Midwest.
Well, we have different technology.
Yeah,
It's cases like this we would use adjustments with
Look.
our hands,
Sure.
and for the soft tissue and tendons we would do soft wave.
Okay, so tell us what the hell is happening. Looks like he's picking his nose.
So it's a technique called
it's part of cranial.
craniofacial
Yeah,
therapy, something
It
like
says
that.
craniofacial release.
Yeah, there we go.
Oh, Bell's palsy. So this guy has Bell's palsy.
he might
He could be.
or something like it.
Okay.
You have
Something.
a neuralgia of some nerve.
Bell's palsy is a nice buzzword though.
Oh, okay.
Maybe. I don't know.
Trigeminal or something.
So anyways, so our skull is a grouping of bones, right? So like as
All
we're
the fissures and stuff.
as we're children, that's why we have like a soft spot, right?
Right.
Because it's unfused bone. It allows our head to grow, but also that's on the external head. We have internal bones like our
Sinuses.
sinuses, internally that are at the base of our skull. They make up our facial structure, our nasal canal, all of those structures. And from injury, like a deviated septum,
Yeah.
or you crack your nose, or you get hit in the face, or whatever it is, can change how the shifting of those bones and those joints. So, go ahead.
And even like chronic stuff, like chronic allergies, sinus issues that can kind of shift things around.
So essentially, what they do, they stick an inflated balloon into your nasal passage.
There we go.
Sounds pretty uncomfortable.
Yeah, it can be.
Yeah.
So you stick it up there,
Okay.
and then you inflate it very quickly, and it
Come on,
can
give us a good
shift
shot.
some things.
Obviously a Patriots fan.
Yeah, they do this out in the
rotation.
East Coast. Out
So
in Boston.
So there's a little balloon off basically a tip of a handcuff, or like a blood pressure cuff. And then he's going to go like a quick whoosh, and it's going to expand and adjust the internal chasms.
It's pretty cool.
Chasms.
Takes a breath in and holds it, usually, I believe. There he goes.
I mean, the anticipation for
Come
this
on
would
now.
make me nervous.
I know. Just do it.
Like it's inside him.
Yeah.
He's just
in
soaking
his
it.
brain.
Yeah.
So is this would this be a technique that you would have to have done numerous times, or is this more of a one and done?
It's probably less.
Yeah.
Yeah.
I know this guy recommends people following up.
Sure.
It's probably like a month,
Yeah.
6 weeks follow up, I'd imagine. I don't know. We'll have to ask Stephanie.
Yeah.
We'll get her back in 6 months.
There you
Wow,
go.
he's like,
See?
get it out.
There's
Oh, that was it.
Shnikes.
there it is. 1529.
Oh,
That looks.
he's just bite
He's
it.
toughing it out. Good job. There you go.
Oh, he's like, all right.
So I mean, like the fear of that is like, do you choke on the balloon?
No, you're not gonna choke on the.
But also, this Cairo here takes some
That was 1530 or so.
1530, yeah. But it's all good.
it's all
And I think he does like preface like this can go through the passage and it will block your breathing. So just like,
Yeah.
just chill out.
Just
I'll pop
chill.
it.
Yeah.
But I mean, some of these people are seeing him like there's chronic issues with sinus stuff, I
Right.
mean, from personal experience too. Like it can affect your life big time. So these people are trying to seek something.
Yeah.
Yeah, it's definitely worth a try.
Yeah, and this guy's intentions are pure. Like he seems like a nice fellow, but he's on TV, so maybe. What's the Tommy boy? I sell
Seems like a
American-
nice guy. Seems like a guy.
He seems like a nice guy.
This is the guy trying to buy the company, not to mention put you out in the street, and all you can say is, he seems like a nice guy.
He does.
Anyway,
Should chiropractors be allowed to treat babies and children?
ABC News.
Oh, good. We get some good
Oh,
coverage
this is
on
the
that.
this is going to show the New Zealand guy.
Okay.
So this guy, like this was back when I was in school. We were in school.
Yep.
This guy got he actually got kicked off of YouTube, I think.
Oh yeah.
And for the record, you guys both work and treat babies. Is there?
Yeah, it's not our. I mean, he can speak for himself. It's not my like I won't advertise for it. Like I wouldn't like put an ad out. Not because I don't think it's appropriate, but it's not what I want to focus on as a clinician.
Yep.
There are some chiropractors this is all they do.
Sure.
This guy's at Gonstead Chiro. I know that. Pretty well known YouTube person, but he posted this video and it caught wind in a bad way.
Let a pelvis drop down a bit. I'm going to take that contact there like that. I have to, unfortunately, just extend her a little bit to get it in the right place. That's why we quick. Darling. Hey. Just stop. Just
Okay, so what did we see there?
So what he did is use his fingertips.
Mm-hmm.
This is what it looked like. Look at his fingertips. And he did an adjustment in the thoracic spine, which probably theory-wise of why he's doing that is because nerve innervation of our thoracic spine controls GI systems, esophagus, stomach.
And when he
Stuff like
says
that.
controls, the nerves literally come out of that area and go to those organ systems.
Yeah.
So there's, I would say, a spectrum of confidence. You know, like what's your confidence interval on that? Like chiropractic, like the old school is based like treat this area for these things.
Yeah.
Mm-hmm.
But going back to the original chiropractic technique, we're not treating conditions, we're treating the spine, which helps the body fix itself.
That's such an important thing for people, I think, that don't understand.
Right. So like
you just don't
ABC
even think about
News,
that. Right.
the guy says like, oh, I'm doing this to treat colic. Like out of context, that sounds really like,
Yeah. Like
I'm replacing all the medical positions by this adjustment.
Yeah.
Well, that's not,
No.
no, that's not what he means. It's just like this area can help relieve these things because the spine is controlling the system or
Right.
protecting the nervous system. And if we believe in the premise of chiropractic, which most chiropractors do, like, I'm not going to give this baby antibiotics because of what's going on.
Yeah.
Let's get an adjustment and see if it,
See if it
does
helps.
better.
If
Yeah.
not, then next thing. Yeah.
So he's using his fingertips and he
Mhm.
applies a force posterior to anterior, so from the back to the
Mhm.
front in a quick form. And I think they said like something about it created an audible.
Yeah. And in this
Which-
video, you hear a little release like a knuckle,
Mhm.
like that.
So like when the general public probably sees that, they think something's breaking.
He also has his
Right.
microphone
Which is-
right there, too.
Yeah, yeah. Which, I mean, yeah, probably just don't put this on YouTube.
But he's proud. I mean,
Like-
if this is true, this is his baby,
Yeah,
and he's proud to show like how he's helping his.
yeah.
sure.
People.
Yeah, right.
Mhm.
All right,
Okay, so
where were we?
this is a boy. Okay.
So this
So
young
you're gonna
boy
say-
is an ear infection, and they're just gonna throw this guy.
Under the bus.
Bang!
Yeah,
Awesome.
that was a good adjustment.
Mhm. Yeah, he's
And-
gonna have a little reaction,
Mm-hmm.
Yeah. I mean, what's more pure than a kid's reaction to something?
Mm-hmm.
and then some people, comment like, "Oh, why does he have the kid's shirt off?" Well, that's how Gonstead
Jesus
chiropractors
Christ.
practice.
Yeah.
Right.
They like to have skin contact.
Yeah. Right.
So just chill out. People.
So to
Goddamn
talk about
Karens.
like, do you guys ever have that experience with kids? So talk about that.
Like the emotional release.
Yeah.
Yeah, we have it with adults too. We
Right.
talked about this
I've
with
had
Brittany
it before. Yeah. So
in
go-
episode 1 or episode
we
3,
did, didn't we?
whatever.
5, I think. Yeah.
Oh, totally.
Mm-hmm.
I've had kids that their parents were going through a divorce, and you can kind of time it up when their symptoms started to when their parents started separating.
Right.
I'm
and you
stressed
adjust
out.
them and you release this physical stress where, I mean, everybody does it, but kids, like, they internalize a lot of things, and that can show up in different ways. And you adjust them, and it's just
Yeah.
an emotion,
Yeah.
right? I mean, probably the reason why adults don't do it more is because they actually have like the know-how to like hold it back.
Yeah. They're guarding it and
Yeah.
defense mechanisms.
But if
for
you were
it.
to like, I'd be curious if I was just to adjust somebody for the first time and just leave right away and just close the door,
Right.
just have a
Just
camera on
sit
them,
there.
what would be like? So, yeah, and we may never know. You know, it's a theory. There's no hard evidence that I could ever show somebody that that's the reason why. But yeah, we see it. I mean, a lot of empirical evidence with that.
Yeah, and that's as a chiropractor, you got to put your line in the sand wherever you are comfortable with it. And some people they're on a soapbox and shouting to the high heavens that let's adjust C1 and that's going to help all your organ systems perform. It's like you can't put that in a vial and test it objectively. But I think most chiropractors are pure with their intentions, and if we're just trying to help people without surgery or pharmaceuticals.
A lot of times we can help a lot of people, but there's cases. I mean, I just had to discharge a patient from care because he wasn't getting better.
Sure.
So
Yeah.
I get him to the right spot, but yeah, there's definitely like people want the answer to your
Yeah.
point. They just want to get things fixed. And
Yep.
Yeah, and parents with kiddos too.
Parents,
we're all
jeez, even
we're all
more, for
parents,
sure.
and it's like when your kid isn't doing well, it's just like
Give me.
what's the parental tolerance to suffering?
It's
Some people are
pretty
like,
low.
nope, not gonna let and so I think as long as the kid gets through it and they're happy and healthy and thriving, that's the goal.
Yeah. Yeah.
And not to extend their but sometimes I think there's an overarching lesson with some patients too. It's like life isn't great all the time, and these opportunities for us to get heal and help you get through this is going to give you some data points for the next round.
Because it's
The
going to get
next
shitty
time
again.
your low back hurts, here's what we did last time, let's try to do it again, and here's some things to stay out of it. I think that the other thing I would like to gripe on is some of the chiropractors in the industry right now that are like anti-chiro, the ones that just post like, oh, if your chiropractor tells you to come back after an adjustment, they're not serving you the best way. It's like, okay, but what if the patient has zero time to do hip moves and sit on their floor and do mobilizers and clamshells and all this bullshit? It's like, I just want to see somebody that's going to help me a little bit.
Yeah.
And that's okay too.
Yeah.
I think,
Yeah. And yeah. So like we talk about all these different techniques that people have, and you guys, the theme that I'm hearing is that there's pros and cons to everything. It's not for everybody. It shouldn't be for everybody. You got to go on your own journey to find it. And SoftWave could fall under this category of unique techniques, unique application, unique therapies.
Yes.
I'd say,
not everybody does it, but so where does it fall in line? And
I'd say yes and no. Sorry, if you're going to say something.
I'm listening to you.
I'd say yes and no, because it's not really a technique. It's an adjunct to our technique. And chiropractic in itself SoftWave in itself does a really good job at just helping the body heal, but paired up with chiropractic, we just see
it's a supersonic technique.
It's a supersonic technique. So that's pretty much all I have to say about it. So what do you got?
I mean, you're the one who drugged me into it.
Is that right?
Yeah, I drugged him.
Drugged him and then bought it. Took his wallet.
Yeah, he did that hammer chiropractic technique into my.
I'm
right
like,
here.
do we want the hammer technique or SoftWave?
Oh, God.
SoftWave.
I don't know. He went with the SoftWave.
This is a cute thing here.
Yeah.
Say your question again, Richie.
Well, I think it's just like why SoftWave? Why have you guys chosen? Because we've seen like there's a lot of chiropractors that do general chiropractic. It's not the right term, but they incorporate some specialty maybe or some special tool or application.
Yeah,
so why SoftWave?
So straight versus mixers. Like there's some chiropractic people out there that are like just adjust the spine and that'll take care of everything.
Those are more straight.
Yeah, those are straight chiros, or the mixers who are like on the straight side of things, they'd be like, oh, the chiros that don't have what it takes to like help people. They need other therapies. They need to be like PTs. They need to be like massage therapists.
Perfect example of people wanting black and white again.
Right, which is fine. And so the mixers would be like, oh, the dumb chiros. But some of those straight chiros are really good, and they do a good job. And they say like, I'm just here to be a chiropractor, and that's it. This is to the letter of the law. Just adjust the spine and get out of the way. There is some simplicity and like it's a purist approach. That's fine, and they help a lot of people. But for us, I think it's defined on like, what do you want to help people with? We would like to help people with as much as we can. I think there are some stop gaps that SoftWave fills orthopedically. People who like truly need like a middle rung between chiro, super conservative, and surgery, and those who are like very shy of having surgery. SoftWave is a very robust option for that.
Because what does it do?
SoftWave.
Sorry.
I
mean, not everybody's
Do you
seen
need
our
new
stuff.
content on SoftWave?
No. Hey, look at here. We got a SoftWave machine. It helps stimulate the body's mechanism to heal.
I just went through 7 hours of your footage.
SoftWave, Richie, SoftWave. The reasons, like the basic model of SoftWave, we're going to push inflammation out of the injured tissue, if there is. We're going to stimulate blood flow and create bigger vessels for the exchange of fluids in the area, and then stem cell activation and a catch-all of other things too.
Activation of collagen.
Yeah. So like
building block.
The studies that are done, like there's some rat studies where they clip Achilles of rats, and they reattach them and they do SoftWave, and you can see like the fibers laying down better.
Cool.
I mean, because like to your point, I'd say we're more mixers, but there is, to your point, like the simplicity. There's a beauty with that. I think that's our starting point with everybody. And if we get to a point either we're plateauing or not progressing, then we always have SoftWave as a back thing. Like this isn't just adjustments to your spine,
right,
or whatever it is.
And then from that branch too, it's like we've released a couple people. Like the SoftWave is not working the way we expect it to. Let's go get some imaging and go down some different rabbit holes. So.
Yeah.
It really, I think it's a tool that we can leverage. Like if you're unsure of surgical or injection therapy, this is a great place to be.
Yeah.
So
Yeah.
We're the perfect blend.
That's
We
what I'm
are-
gathering.
Yeah, everyone else
The
sucks
perfect.
compared to us.
That's not true.
We're just two guys trying to make a living as chiropractors. That's what it comes down to. Just trying to succeed.
Get
Trying
through
to help
this
people.
crazy world.
Just trying to help people. Just do good by people, you know.
Yeah.
All right, on that note.
Okay, that's a wrap.
Yeah,
On the tap.
nice job.
This is a house of learned doctors. You're not a doctor.